Our discussion today is on monkeypox virus. The monkeypox, or Mpox virus, is a member of the genus Orthopox, which belongs to the family Poxviridae. Other members of this family include cowpox, vaccinia and variola, also known as the smallpox virus. It is a zoonotic virus with primary transmission believed to occur through direct contact with infected animals or possibly by ingestion of their inadequately cooked flesh. Inoculation may be from cutaneous or mucosal lesions on the animal, especially when the skin barrier is compromised secondary to bites, scratches or other trauma. The infection was first seen in laboratory monkeys in 1958, thus the name monkeypox, although rodents are believed to be the major reservoir in Africa. People living in or near the forested areas may have indirect or low-level exposure, possibly leading to subclinical infection. Secondary or human-to-human disease transmission was found to be another possible route as a major factor in the 2022 outbreak in multiple areas across the world. Sexual transmission of monkeypox has not been conclusively confirmed, but appears likely. In the DRC in 1997, animals caught from the wild were tested for the monkeypox virus. These animals were found to have neutralizing antibodies against the monkeypox virus, suggesting a role as natural reservoirs. The most reliable clinical sign differentiating monkeypox from smallpox and chickenpox is enlarged lymph nodes, especially the submental, submandibular, cervical and inguinal nodes. These symptoms may include scant or even single lesions, or even the complete absence of skin lesions. Lesions can also present in the genital and perineal areas, presenting with anal pain and bleeding. Presence of prodromal symptoms such as fever, myalgias, fatigue and headache before the appearance of a rash. Others may experience lesions and discomfort around the perineal region. Diagnosis involves the isolation of the monkeypox virus in culture from a sample obtained from the patient. Additionally, the demonstration of the monkeypox virus on PCR in a specimen obtained from the patient is another method. Treatment. In the African cases, the mortality rate was 1 to 10%, and death was related to the patient's health status and other comorbidities. Most patients died of secondary infections. Patients often feed poorly during the febrile stage of the illness. Therefore, bed rest along with supportive care may be necessary. Hospitalization may be necessary in patients with severe conditions. To avoid infection of healthcare workers and close contacts, infection prevention and control precautions must be considered. This includes isolation of the infected person, use of PPE, face masks and gloves while dealing with the infected patient. Isolation must be continued until the last crust is shed. Antiviral drugs like Cidofovir can also be used. Vaccination is key for prevention of the disease. Other forms of prevention include avoiding contact with infected animals, avoiding sexual contact with infected individuals, and avoidance of uncooked meat. Thank you. Please like, share and subscribe.